for our website coordinated by the GITS, the German International International Corporation of from Germany. We would like to draw the picture of Corona pandemic right now in Africa, and this where it's great that you give us your time to get an idea on your perspective about the situation in Africa right now. Could you give us the big picture of Corona pandemic right now in Africa? Where is Africa right now in this pandemic?
Thank you. I think looking at it very broadly across the whole continent, the pandemic, I would say, is in the mid-morning. If I use the day as analogy, it is in mid-morning, while in Europe, North America is probably in late afternoon. In China, it has reached dusk already. So we are in the mid-morning of the pandemic, where we are seeing numbers increasing at rates that it probably is doubling every 5-6 days or so. The numbers are doubling. And this gives us the motivation to be able to work even harder to try and flatten this curve. In terms of what we are doing as Africa CDC and countries in Africa, we started very early. As soon as we saw what was happening in China, we started to prepare by building capacity and putting in place systems, securing borders, encouraging social distancing, and measures like these. We started early, and those early measures have resulted in delayed spread of coronavirus in Africa. So in general, there is a lot more that needs to be done because the numbers are increasing. The rate is not very high, and this tells us that the early measures we took are actually working.
Okay. Did each African country act by its own, or how strongly was it possible for the CDC to coordinate all efforts?
Africa CDC is actually coordinating many aspects of the preparedness and response. At the same time, individual countries are also doing their work at country level. For example, the first case was diagnosed in Africa in Egypt around February 14th. And 1 week later, as Africa CDC, we convened a meeting of health ministers of all the 55 member states. So this was our first step at coordination. We brought together the health ministers. The health ministers discussed what needs to be done on the African continent. They passed and adopted the continental strategy. And after doing that, we started to implement that particular strategy. So as Africa CDC, we have been coordinating capacity building. We have been coordinating inter-country activities. We have been coordinating procurement of personal protective equipment and laboratory supplies across the continent. And we've also been coordinating the deployment of experts across of Africa based on country needs and based on country requests. So we have been doing a lot of the coordination, but individual countries are doing implementation at their own country level.
Mm-hmm. What are the current figures right now in Africa of infections and diseased people? I have the numbers of the Johns Hopkins University, but with which figures are you working right now?
If you look at our website, we have on a daily basis, we are updating the figures as it happens. And then sharing with member states, we are sharing that twice a day. at 9 o'clock in the morning and then at 6 o'clock in the afternoon. As of this morning, we had 54 out of the 55 member states have been affected. We have 99,062 cases. As of this morning, the number of deaths is 3,082, and the number of people who have recovered is 39,085. These numbers, of course, are changing during the day, but that is the situation as of this morning at 9 o'clock.
And are you pretty confident that the figures are precise, or is it difficult to really judge the real situation by the figures?
The way we get our figures is from the governments themselves.
Yeah.
And we are reasonably confident that governments are providing us with a correct picture based on the testing that is going on at country level. So figures are a function of identifying a potential case, testing that case, and then you get a positive or a negative.
Yeah.
So long as the surveillance is enhanced at country level, there should be, and then the capacity for testing is also present at country level, then the figures should be able to reflect what is happening in the country. In fact, when we look at each and every country, they give us figures of how many people they have tested in a day and how many have turned positive. So it means there is actually active testing that is going on across the vast majority of countries on the continent. So the figures that we see are a reflection. They may not be 100% accurate because there are many asymptomatic people.
Yeah.
I mean, this we accept. But in terms of those that are being identified as potential cases and being tested, it gives a relatively good picture of what is actually happening on the continent, both in terms of numbers and in terms of trends.
And how would you judge the testing capacities in general?
Yeah, right. Now, let me go back to January. When this virus was reported to have entered the human population in China in January, we had no laboratory or country on the African continent that could be able to test for COVID-19. 2 weeks later, in the beginning of February, we had two laboratories, one in Senegal and one in South Africa, that could be able to test for COVID-19. At that stage, we came in as Africa CDC and started to build capacity of laboratories across the continent. As we speak today, 52 countries out of the 55 countries can do laboratory testing within their own countries. And most of them can do it in more than one site. So we have built capacity very rapidly so that each country can independently be able to do its own testing. Now, when we look at the capacity for testing, we must also look at availability of test kits because we need these for the actual testing. This has been our biggest challenge because the test kits are manufactured outside of Africa. So we have to procure them and then bring them onto the continent and then distribute them to countries. And this has been quite a significant challenge because air travel has been banned. So transporting reagents and the test kits themselves has been quite difficult on the continent, but we have managed to make sure that all the 55 countries are regularly getting test kits. So the capacity for testing has increased tremendously. And we see that in the reflection of the number of tests that are being carried out. As of today, we have conducted across Africa, the number of tests that have been conducted is in excess of 1.2 million. And our plan is that over the next 4 weeks, we are going to test 1 more million. And over the next 24 weeks, we are going to test 10 more million. So our strategy is to expand testing, and depending on the numbers that are turning out positive, to then isolate them and manage their cases depending on whether it's severe or whether it is mild. Following this, we have developed an initiative called the Partnership for Accelerated COVID-19 Testing, called PACT. And it has three main goals. The first goal is to test, the second is to trace, and the third is to treat. So it is test, trace, treat. That is what the PACT initiative is about, the Partnership for Accelerated COVID-19 Testing. The whole reason why we developed this initiative is so that we can be able to support our member states to increase and expand targeted testing. It is not testing of everyone, it is targeted testing. Those who fit the criteria that we have established, those are going to be tested, and depending on those who turn positive, then we can move to their contacts and secure their contacts. That way we want to break the transmission within the community. So this is the way I will be able to respond to the issue around capacity for testing.
Okay, yeah, thank you. Did the Ebola crisis and the fight against tuberculosis and other diseases, let's say, already provide experience and to be better prepared for a pandemic like Corona?
Yes. Our experience with outbreaks on the continent has given us lessons, and learning from these lessons, we are able to respond better to Corona. And the most famous of the outbreaks was the West Africa Ebola outbreak. Now, a few things that we have learned and we have used in addressing COVID-19. One is to start early. Don't delay. If there is an outbreak, you start early. And we have done that with coronavirus. Many countries with very low numbers are instituting measures that even Europe and North America are not doing. So start early. This is one very key lesson we have learned. The second key lesson we have learned is solidarity, which means neighbors helping neighbors. If we look at our response in terms of several countries together as neighbors, it is more effective. Because if you try to do it alone, then your neighbors' problems will quickly become your own. Because the virus spreads across borders, it doesn't need a visa. So it will spread from one place to the other and cause problems to those areas that have not yet experienced coronavirus. So solidarity and working together is a very important lesson that we've learned. The third lesson that I will be able to share here is one of partnerships. And partnerships are very key in knowing what new methods may be of not only identifying, but also managing those that have been found to have coronavirus. So we have gone into partnership across the globe with individual countries, with intergovernmental organizations, with private philanthropies and foundations. We've gone into a lot of these partnerships, and all of them are designed to support our work in implementing the COVID-19 strategy.
Was it also, in a sense, helpful that people already, the normal population, understands better infectious diseases by outbreaks like Ebola?
Absolutely. In fact, two things I would like to say around understanding infectious diseases. One is the communities in Africa are faced with many different types of infectious disease on a daily basis. And those that have reached outbreak levels like Lassa fever, monkeypox, Ebola, measles. These ones have, the experience with these ones have resulted in the population being able to respond more easily to this coronavirus. The second thing is that by developing better and healthier habits, we are seeing cases of more simple infectious diseases dropping. They're becoming less, simply because we are having better hygiene practices during this time of coronavirus. So both sides are contributing to the larger public health agenda and the larger health system strengthening agenda. So exposure to other outbreaks, exposure to other infectious diseases, certainly the experience that we've had with those is contributing now to what we need to do with coronavirus.
There have been doubts if the measures to limit corona might increase the number of people infected by other diseases, like tuberculosis or malaria. Is that a danger?
It is a very big concern that we have, and indeed it is a risk that is present in a number of countries. But as Africa CDC, as we engage with governments, as we engage with our partners on the continent, our message is very simple, that don't treat coronavirus only. Designate a few hospitals that are going to look after coronavirus cases, and all the other hospitals, let them continue to work so that they can be able to look after other people that require the attention and ensure that the rest of the health system is actually functioning. So this is we are encouraging governments to ensure that the investment in addressing coronavirus does not reduce the investment in the other areas of public health and the clinical care and prevention and therapy. That way, you don't get to address one problem while others are also building up.
And do you think that the lockdown measures in other countries like Europe or United States or China might affect economic growth rates so much that there are serious health effects on the population?
Yes, everywhere, not just in Europe, China, and North America, everywhere. Any increase in the numbers of cases will have a very large negative effect on the economy and a very large negative effect on businesses. So it is for this reason that we are about to launch a guidance document, which is really addressing the issue of lockdowns and how to progressively open up the lockdowns for people to be able to go back to their normal economic activities. This is going to be launched in the next few days as our contribution towards COVID-19 outbreak preparedness and response.
Okay. If Bill Gates says that there might be the danger of 10 million people dying in Africa because of corona, do you think it's helpful or rather useless, such sort of predictions?
We must take predictions with a lot of care, because sometimes numbers scare the population, and this will result in panic. And panic is very bad when you have an infectious disease outbreak. People behave in manners that are not consistent with good public health science. But predictions are good for planning. And when we do the modeling and we predict numbers, it makes us as Africa CDC start planning ahead, that we know this thing may go like this, so let us buy these items to support the process. If the infection is going to spread fast amongst the population, it also means that the numbers of the critically ill will be a bit high, and the health system will definitely be under strain. It is very important that governments, and we are encouraging them, that governments put in place a good feedback mechanism, so that if a case is starting in a facility way out of the town, it can also still be able to be picked using the regular reporting methodology that we have put in place.
The WHO was predicting, according to estimations, 150,000 deaths. Is it also a figure you're working with, or how do you look at it?
At Africa CDC, we do modeling internally. And apart from doing modeling, the figures that we get, we use internally for planning. We don't share with the public because they change. The parameters we use for modeling are such that what was the figure yesterday will change rapidly to today, depending on whether the measures that have been put in place by governments are working or not working, and also depending on what type of measures the governments have put in place. So we avoid going into the numbers, but we definitely are building capacity across Africa. And across our agency, the Africa CDC and Africa Union, so that we are better prepared to be able to tackle these problems and issues when they come up. But across Africa, we are strengthening the country level teams, and these are acting as a very good bridge between us and the country level activities that are definitely going on now around COVID-19.
Okay. Thank you very much. I want to come back to one information you gave me. I'm not sure if I understood right. You said as flights are banned, it's not possible to fly in test kits. Is that not even for test kits? There are flights permitted?
Right now, the only flights that are flying are cargo flights.
Yeah.
And cargo flights are very irregular in the sense that they are not scheduled flights. So you don't fly to a place where you don't have cargo to take.
Yeah.
Only if you have cargo to take it there, then you'll be able to fly there.
Yeah.
So it is very important to note that we have been using the bulk buying system and protocol, and then we put all those materials into one plane and then bring it here. Yes, so movement of test kits has been a challenge, but we are still getting opportunities to be able to move the test kits to all the 55 member states. It is a challenge, but it is possible to do with some delays because of the way the cargo flights are giving themselves permission to get into our country. It means that the shortage is always there, but we are able to transport the lab reagents, and countries are able to continue doing testing.
And does each country look for itself to schedule these cargo flights and getting the test kits, or is the CDC coordinating the efforts?
No, we are coordinating those efforts. Countries are not doing much buying because we want to benefit from the large quantities that we usually order. The price can come down. We want to be able to benefit from that. Secondly, is we want to be able to ensure that all players have been involved in this particular new space. All players, whether they are bilateral or multilateral partners, all of them need to be fully engaged and involved so that the guidance can already have input from countries, which is fast.
That means the CDC is buying for the 54 African countries the test kits?
Yes, we are buying for all 55 members.
Ah, okay. Interesting. Thank you so much. Thank you so much for your time and all the information. I will write the interview and send you an English version for authorization.
No problem. We will be here to receive.
Is it possible to get a photo of yours? Shall I ask your assistant, or how could I get it?
Yes. No, ask her. Ask her, she will give you one.
Okay. Thank you so much for your time, and I'll send you the email.
Thank you very much, and you have a good afternoon, and stay safe.
Thank you.
Okay, bye-bye.
Bye-bye.